In simple words, we all know that hemorrhage is a blood loss, but it is properly defined as escape of blood from the blood vessel or extravasation of blood due to the blood vessel rupture. Here you will ask, what is the extravasation? So it came from the word extravasate, and this word made by the two words. Extra means outside and vas means any blood vessel. So extravasation simply means leakage of blood, lymph or any fluid from the blood vessel. Hemorrhage can happen in two ways. First is a hemorrhage by the Rrhexis. Here suffix Rrhexis means rupture or break of a blood vessel and it leads to the hemorrhage. And in second way, hemorrhage by the Diapedesis. When blood comes out from a intact normal looking blood vessel into the surrounding tissue. Hemorrhage can be classified into external hemorrhage and internal hemorrhage. First one is a external hemorrhage. It occurred from open wound or through a natural orifices of the body. For example, as shown in the picture, open wound cause blood loss, that is the hemorrhage. And here the few examples of the hemorrhage that occurred from a natural or external orifices of the body. For instance, epistaxis means bleeding come out from the nose. Hemoptysis means bleeding from a lungs or respiratory passage, or it is also called a blood in the sputum. Next is a hematemesis, meaning bleeding in the vomition. Next is a hematuria, meaning blood that come out in a urine. Melena means blood passes through the feces, while Petechiae means fresh blood in the feces. Second is a internal hemorrhage, in which bleeding takes place within the body and blood collect in any of the natural body cavity or in the newly formed cavity. That's why it is known as internal hemorrhage. When blood collects in the newly formed cavity or abnormal cavity, it is known as hematoma or hematocyst. Here are the few examples of internal hemorrhage. Hemothorax or hemopleura, meaning hemorrhage into the pleural cavity, that is the space between the lungs and the wall of the chest. Next is a hemopericardium, hemorrhage into the pericardial space. Next is a hemoperinteum, meaning hemorrhage into the peritoneal cavity. Next is a hemarthrosis, meaning hemorrhage in the joint. Next is a enterorrhagia, meaning hemorrhage in the intestine. Next is a hemometra, meaning hemorrhage or collection of blood into the uterus, while metrorrhagia is an abnormal bleeding from the uterus. Actually, it is an abnormal uterine bleeding that occur at the irregular intervals of the menstrual cycle. Next is a hematocolpos, meaning hemorrhage or accumulation of blood within the vagina. Next is a hematosalpinx or hemosalpinx, meaning hemorrhage or accumulation of blood in the fallopian tube or oviduct. Next is a hematocele, that is the abnormal collection of blood between the two layers of tunica vaginalis in the testis. Next is a hematomyelia, meaning hemorrhage in the spinal cord. Next is a apoplexy, means brain hemorrhage. Hemorrhage can also be classified according to the size and shape, in which petechiae or petechial hemorrhage, meaning tiny pinpoint hemorrhage that can occur on the skin, subcutaneous and mucous membrane, exactly as shown in the picture. Petechial hemorrhage are 1 to 2 mm in diameter. Next is a purpura hemorrhage. Do not call it kurkure because it is purpure. Just kidding guys. Actually, purpura hemorrhage are approximately 3 to 5 mm in diameter as shown in the picture. Then last is a ecchymoses or echymotic hemorrhage, which are the larger subcutaneous hemorrhage which has about 1 to 2 cm in diameter, exactly as shown in the picture. For example, brucis is one type of ecchymoses hemorrhage. Hemorrhage can also be classified as a primary, reactionary and secondary hemorrhage. First is a primary hemorrhage. This type of hemorrhage occurs immediately after the injury. Second one is a reactionary hemorrhage, which is also known as intermediate or recurrent hemorrhage. This type of hemorrhage occurs within the 24 hours after the primary bleeding has been stopped or controlled. This type of hemorrhage also occurred due to the mechanical disturbance of a clot in the vessel and also due to the slipping of ligature. It means suture has been slipped out from the wound and it results into the bleeding. Last type is a secondary hemorrhage, which occur after 14 days or more due to the septic disintegration of a clot, meaning clot breakdown occur and it lead to the bleeding as shown in the picture. Hemorrhage can also be classified as a arterial, venous and capillary hemorrhage. Capillary hemorrhage have a slow and even flow and it have the bright red color, while venous hemorrhage have a steady and slow flow and it is the dark red in color. Lastly, arterial hemorrhage is a bright red in color and it have the pulsating flow, and in this type of hemorrhage blood spurting fastly, meaning blood flow out suddenly with a force in a fast stream as shown in the picture.